All right, welcome back to Quick Hits. Let's cover right bundle branch blocks. We just went over the left bundles. I think it's time we can do the right bundles. This is the other great masquerader that a lot of people get confused as a STEMI. So let's launch right into it. So right bundles, we went over last time what normal conduction is. Well, with a right bundle, it's actually quite opposite. There's actually a delayed activation of the right ventricle as the depolarization it basically originates from that left ventricle and then crosses over the septum, and that causes that right bundle branch block appearance. So what is the diagnostic criteria for a right bundle? Well, just like a left bundle, the QRS duration has to be greater than 120 milliseconds. So in V1, you can see that right there. That's definitely greater than 120 milliseconds. And then again, I want you to focus on three leads: V1, lead 1, and V6. These are the three leads you're going to look at basically for your bundle branch block. So lead V1, you've got the rabbit ears, right? It's M-shaped, it's upright. That is your classic right bundle branch block look. You may sometimes not have complete rabbit ears, just be aware of that. There are some variants of it, but that's your pretty pathognomonic picture of a right bundle. If you go to lead 1 and lead V6, what you're going to find is a slurred S wave. Now, what is the S wave? That's that little segment that notches right after you have that upright R wave. So you see that R wave, and then it goes all the way down, and then it comes up to that ST segment. That is your S wave. And that slurred S wave is what is classic for a right bundle as well. So let's look at V1 again. As you can see, the rabbit ears look a little different in this one. It's upright, it's wide, greater than 120 milliseconds. But you can see that teeny little notch, and then you have that big upright R prime. So basically the way that rabbit ear works is you have an R, S, and then you have an R prime. And that is classic for a right bundle branch block in your V1 lead. When we go to our lateral leads, again, this demonstrates that slurred S wave. You can see it's circled right there. That is pathognomonic for V6 and lead 1. You're going to see that, and that is what differentiates also that right bundle from your other bundle branch blocks. Now, again, appropriate discordance. Remember, there are two terms we have: discordance and concordance. Discordance is good in a bundle branch block. Concordance is bad. So your discordance here refers to the fact in lead V1, that ST segment looks like it's actually a little depressed, especially if you start taking a look at V2 right after that RSR or your rabbit ears, and that is normal. If you look in your lateral leads in 1 and V6, you should not have a concordance, meaning it should not have any ST segment elevation. Instead, you have that slurred S wave, and that slurred S wave is appropriate for a right bundle. So again, discordance. The biggest discordance you're going to see with the right bundle is in those anterior septal leads, and that is that ST segment that drops right after the bunny ears. So what causes a right bundle? Anything that can cause strain on the right side of your heart. So, for example, massive PE. Now, I do want to warn you, just because someone has a right bundle does not mean they have a PE. But if you're patient, you don't have an old EKG, or they say, I've never heard of a bundle branch block, or they don't know what that is, or say this looks different than the old EKG. And then let's say they're having severe dyspnea that was sudden onset, they've recently had surgery, everything's pointing towards PE, and you have a right bundle, that should make you a little suspicious, right? But you could also have right ventricular hypertrophy, ischemic heart disease, congenital heart diseases will cause this, myocarditis, cardiomyopathy. These are some of your classic causes of a right bundle branch block. So again, this is that little picture I showed you in the left bundle branch block lecture. This tells you the difference here of what your left bundle from your right bundle. If you look at your lead V1 in a left bundle, you have that deep S wave. It's extending on the below that ST segment, but then you have in the right bundle, you have that RSR, which is actually reflecting positive or up above that ST segment. And then both have their appropriate discordances, whereas in a left bundle branch block in V1, you have that slight elevation of your ST segment, whereas V1 in a right bundle branch block, you have that slight depression of that ST segment, which is normal for the right bundle branch block. If you look at V6, in a left bundle, you have that upright R wave, and then you can have that discordance of that ST segment having some depression there, and that's normal. But if you look at the right bundle branch block, what's normal is you're going to have that slurred S wave on V6, which is pathognomonic for it as well, and you'll also see that in lead 1. So what are some examples? This is a great example. So first of all, look at V1. You've got greater than 120 milliseconds, and you have those bunny rabbit ears right there. So that's fairly classic for it. And then if you look down in V6 and you also look at V1, both leads, you're going to see that slurred S wave that comes right after that R complex. So that is your right bundle branch block. If you look here again, you see the bunny rabbit ears, and you can see that it's wider than 120 milliseconds. And then if you go to lead in V6 as well as lead 1, you're going to see that slurred S wave, and that's also classic for your right bundle branch block. And you have appropriate discordance. Here again is another example. You see that RSR pattern of the bunny rabbit ears in V1. It's wider than 120 milliseconds. And then you can just barely see that slurred S in 1 and V6. Some would say this is borderline incomplete right bundle branch block, but it's very close to it. But those bunny rabbit ears really do give it away. Here again, this is a little different appearing R wave in lead V1. You don't have the bunny rabbit ears, but you have a large R wave, and then you have that discordance. But then if you look at lead 1 and V6, in both of those leads, you actually can see that you have that slurred S segment there. So that is a right bundle as well. It just doesn't have that classic bunny rabbit ears look to it. And this is an incomplete bundle. If you look at your RSR in lead V1, you have that bunny rabbit appearance, but it's not greater than 120 milliseconds. And then you don't really see a great slurred S wave in lead 1 and V6. So it is not quite there, but it will likely progress to that point over time as more damage is done. Finally, if you look at this, is this a STEMI? And the reason why I ask is because this was actually a patient that was called a STEMI by an agency, and obviously now that you've had the education, you can look at it and you can say, well, look, we've got a big R wave in V1, and it's greater than 120 milliseconds, so okay, that suggests potentially a right bundle. Let me look at lead 1, let me look at V6. Oh, both have these large slurred S waves. There appears to be appropriate discordance. There's no concordance, so this must be a right bundle and not a STEMI. So I hope this clarifies right bundle branch block. My goal is next to come up with a lecture for you all looking at what are the STEMI equivalents in left bundles and right bundles. But I hope this helps. Feel free to reach out if you have any questions. Thanks for your time.